Optomed Smartscope, simply brilliant. With the development of medical science, the survival rate of premature infants is increasing. But consequent problems like retinopathy of prematurity are threatening premature infants with visual loss. Retinopathy of prematurity is a disorder of the developing retina of low birth weight preterm infants that can potentially lead to blindness. With proper screening and treatment, unfavorable structural outcomes were reduced from 48% to 27%, and unfavorable visual outcomes were reduced from 62% to 44%. The occurrence of ROP in premature infants is 10% to 34%, causing 5% to 8% blindness in children. ROP has become the most common cause of blindness worldwide. Infants with a birth weight of less than or equal to 1,500 grams or gestational age of 30 weeks or less, and selected infants with a birth weight between 1,500 and 2,000 grams or gestational age of greater than 30 weeks with an unstable clinical course are at high risk for ROP and should have retinal screening examinations performed after pupillary dilation to detect ROP. Without an appropriate screening tool, the screening of ROP is inefficient. An indirect ophthalmoscope can only be used by ophthalmologists, and no medical evidence can be photographically documented. A contact fundus camera may cause cross-infection and corneal injury. It also cannot be operated in the incubator. Smartscope provides you a non-contact, convenient way to do ROP screening. Don't feed any milk or water for 1 hour before the examination. Dilate pupils with dilating drops for 5 times every 5 minutes before examining. Surface anesthesia can be given. Anesthesia and dilating drops are safe to the infant. The dilated pupils will recover in 4 hours. Use a lid speculum to widen the baby's eyelid for adequate screening of the fundus. Choose auto mode. Set exposure value to 4 or 5. Approach baby's eye vertically. Capture a posterior image. Adjust the direction to capture the peripheral images at nasal, superior, temporal, and inferior area respectively. When anything suspicious is observed, capture the image immediately. Further suggestion will be prescribed. Treatment including laser photocoagulation, intraocular injection, and surgery.
欧世博智能眼投入临床使用以来呢，使我们在早产儿视网膜筛查这一块工作呢变得更加简单、更加有效。因为众所周知呢，我们对早产儿视网膜筛查呢 ，RedCam 是一个金标准，间谍眼底镜呢作为一个重要的一个辅助。那么现在呢，我们加入了手持式的眼底照相仪，那三者取长补短，使我们目前在早产儿视网膜筛查的工作中呢更加高效、更加有效率一些。手持式眼底照相仪，我们主要是针对在 NICU， 就是新生儿急诊病房里面使用，因为这些孩子还需要上呼吸机，还需要吸氧，还需要在暖箱里面。那 RedCam 不能执行这一操作，而间谍眼底镜呢，我们不能360度全方位的观察。那么我们在辅助手持式眼底照相仪，为我们的这项工作提供更加便捷、更加高效。目前在使用来讲，我们的在新生儿急救病房，就是 NICU 的阳性率的检查率是在逐步上升。那对我们的检查工作，我们就更有自信，也更有底气，更好的守护儿童的光明。
Smartscope for precise and reliable imaging.